Welcome to this resource on nephrotic syndrome. We'll cover some helpful information you may see on exams and do practice questions at the end. But first, welcome to Artemis Interactive Media. Artemis is your guide to learning resources and continuing education. You may note a heart at the top of this resource to indicate a condition often covered in pediatric courses, with the color indicating the body system. This quick timeout is a short study break and will cover understanding nephrotic syndrome. If we need any help, Artemis will be here to guide us. Nephrotic syndrome occurs when the glomeruli become damaged and allow large amounts of protein to leak into the urine. This protein loss causes fluid shifts that lead to edema and fluid imbalances. This is most common in young children. Children with nephrotic syndrome commonly develop edema, especially around the eyes and face. Proteinuria may cause foamy urine, and fluid retention can lead to rapid weight gain. Fatigue and decreased appetite are also common symptoms. Complications include increased risk for infection, hypovolemia, blood clot formation, and because proteins are lost in the urine, children may also experience nutritional deficiencies and weakness. Treatment and nursing care often includes corticosteroids. This is used to reduce inflammation and protein loss. Nurses should carefully monitor intake, output, and daily weights. A low sodium diet and fluid management may also be ordered. Preventing infection and monitoring for edema may be part of the treatment plan. In summary, nephrotic syndrome is a kidney disorder that affects kidney filtration and leads to significant protein loss. Edema is a hallmark symptom of nephrotic syndrome. Early recognition, careful monitoring, and medication management improve outcomes, and many children respond well to treatment. Remembering that nephrotic syndrome results in hypoalbuminemia and massive proteinuria can help you recall signs, symptoms, and interventions. For example, hypo is low, albumin is a protein in the blood, and emia is in the blood. So they have low protein in the blood because the kidneys are filtering out massive amounts of protein. Before we test our knowledge, nephrotic syndrome can be a complicated topic to understand. Conditions involving the kidneys often have a systemic effect, so symptoms may include findings that may seem unexpected for general renal issues. The following questions will test our knowledge on the material we covered in this resource, so please answer the following 5 questions to gauge our mastery of this material. Question 1. The nurse assessing a child with nephrotic syndrome would expect which urine characteristic? A. Bright orange urine. B. Bloody urine only. C. Completely clear urine. Or D. Foamy urine. Well, I know with nephrotic syndrome, they spill protein in the urine, so that can make your urine foamy or frothy. So I'm going to say D. Foamy urine. And Artemis says we're right. Proteinuria commonly causes foamy or frothy urine. Thanks, Artemis. Question 2. A nurse is teaching parents about nephrotic syndrome. Which statement best describes this disorder? A. A respiratory disorder causing chronic cough. B. A congenital heart defect. C. A kidney disorder causing protein loss in the urine. D. A neurological disorder affecting movement. And I'm going to say C. A kidney disorder causing protein loss in the urine. And we're correct. Nephrotic syndrome is a kidney disorder in which protein leaks through damaged glomeruli into the urine. Question 3. Which assessment finding is most commonly associated with nephrotic syndrome? A. Severe dehydration. B. Generalized edema. C. Cyanosis. Or D. Hyperactivity. Well, they have hypoalbuminemia, which is low protein in the blood. Because they have proteinuria, they're spilling the protein in the urine. And when you have low protein in the blood, it's hard for you to retain fluid in your vascular space. So I'm going to pick B, generalized edema, due to that fluid shift. And Artemis says we're right. Edema is a hallmark sign caused by protein loss and fluid shifts. Question 4. A nurse understands that children with nephrotic syndrome are at increased risk for which complication? A, infection, B, hearing loss, C, fractures, or D, hyperthyroidism. Well, children with nephrotic syndrome have protein loss, which puts you at risk for infection. So I'm going to say A, infection. Protein loss can impair immune function and increase infection risk. Question 5. Which medication is commonly prescribed to treat nephrotic syndrome? A, bronchodilators, B, corticosteroids, C, NSAIDs, D, antifungal medications. Well, they're at risk for inflammation and infection, so I'm going to say B, corticosteroids. And we're correct. Corticosteroids are frequently used to reduce inflammation and protein loss. Thank you for your attention to this resource provided by Artemis Interactive Media. We hope you found it helpful. This presentation may be used for content review and clinical competencies for pre-conference and post-conference education. This quick timeout can also be used for a short study break. Nephrotic syndrome involves more than this QT covers, so for more information on this disorder, please contact your instructor and refer to your textbook.